Hi everyone, welcome to Childbirth Concierge on YouTube. I am Kathy Bradley, owner of Childbirth Concierge, and today I have with me Dr. April Merritt of Delaney Park OBGYN out of Central Florida. Welcome. And we're decided to get on and chat, and we're good at talking because we are April 2nd of 2020, and we are amid COVID-19. And
Yes.
So I wanted to share with viewers that are watching this, maybe some tips and points on how to navigate being pregnant during COVID-19. I really want to place a disclaimer that this is not medical advice, even though April Merritt is a physician, an obstetrician. We always want to refer you back to your own provider. We're just really wanting people to feel comfortable, a lot of stress, a lot going on. I think I've been doing this a lot more with people, with my kids, with my dogs, because we are indefinitely shifting in new times I don't think anybody worldwide has ever experienced before. And we all know that having a baby is a monumental, huge life experience. And on top of that, we have a pandemic going on. So
Yes.
if you don't mind, and thank you for joining us, share with me kind of what you've been experiencing in your busy practice and what kind of information you're giving your patients.
We've been experiencing stress because having a baby is a stressful event in life. You are carrying this baby for 9 months, and bringing a baby home is stressful, and bringing it home in the middle of a pandemic is, of course, extra stressful. So, of course, I have moms coming in, and they're worried about what's the best thing to do. And honestly, we aren't changing any recommendations from what is being recommended. Stay away from sick people. Make sure that you're keeping your social distancing. Make sure that you're wearing a mask if you're out and about, and then make sure you're washing your hands. That's really, really important. Moms, of course, can be at risk for preterm labor if they get any kind of infection. That goes for the flu, it goes for COVID-19, it goes for even having a tooth abscess. So we're asking our moms to stay healthy. That means taking your prenatal vitamins and staying away from sick contacts. Right now, your safest place for your baby is in your belly. The safer and healthier you can be, the better. We're talking moms through that really because they're just anxious about their babies. But right now, the safest place for that baby is inside your belly.
So in your practice, you're doing telehealth, bringing patients in. Obviously we want our viewers to go back to their providers, and their providers should be communicating with you, but what are you guys doing at your
Correct.
offices?
So
you have more than one office. So
we do. We have 4 offices, and we have physicians at all 4 of our offices. We have taken our annual patients and our routine GYN patients, and we've tried, excuse me.
Is that you, Rona? I couldn't help. I couldn't pass that one up.
Did you notice though, I covered my mouth when
Very
I
good.
or put my face in my elbow, which is what you should be doing.
Yeah.
And I have no one around me, which is where you should be.
Mm-hmm.
So just so you know, if you're out and about. But we have taken our GYN patients and we've started doing telemedicine, kind of like how you and I are right now.
Mm-hmm.
So our GYN patients aren't coming in and being exposed to anybody. And then with our OB patients, we've actually spread out our appointments. And as we've spread out our appointments, they're not really being exposed to each other, which is what we want. We want them to not see each other in the waiting room. We don't want them to actually be exposed to each other. We've asked them not to bring their children in, and we've asked them to leave their children at home with their spouses or with somebody else. And we've also asked them not to bring in their spouses if we can avoid it, unless it's like a situation where they have to have their spouse with them. We've asked them that mostly so that we're not exposing our staff, but we're also not exposing them to unnecessary risks. So that's what we've done in our offices.
And you guys aren't changing offices, right?
No.
You normally would rotate. You're keeping your OBs.
Right. We have kept our OBGYNs in separate offices, so we're not accidentally exposing our staff to each other or to our individual OBGYNs. So I haven't seen my partnered physicians in a little while. I do a lot of texting and calling, even though I normally would see them weekly. I don't. I'm still taking call at the hospital, but we're trying to keep them as separate as possible. I think the patients appreciate that because it's an extra added safety feature that we've added, just to keep us from exposing each other accidentally.
So you mentioned the hospital, and in any of YouTube videos, we try to keep them shorter and brief because our attention spans, especially even now with the COVID-19, is people are all over, including myself at times. Just this is a very, very stressful thing going on. So are patients, what are they asking you about, like coming in labor? What is the experience that you are witnessing, experiencing?
Nobody wants to come into the hospital. And I am so careful to counsel patients about the hospital because nobody wants to come in. They're all afraid that the person sitting next to them is going to infect them with COVID-19. In Central Florida, I work at Winnie Palmer Hospital. We are a women and babies hospital. We mostly just have just that, women and babies. So we have taken all the precautions necessary. We allow one person in as their support person. We are masking mom. We are masking their support person. So we are really trying to take that extra precaution. Across the country, they may not have where they're just women and babies. They have everything. They have cardiac, they have neuro, but hospitals across the country are taking precautions. But they're still scared. They don't want to go into the ER and possibly get exposed. So I tell patients, please don't be scared to go into the hospital. The hospitals are taking the precautions that they need. And don't wait until it's too late because we don't want you delivering on the highway. We don't want you delivering at home. We want you to be safe. Talk to your providers about things. At my hospital, we don't want you delivering in valet parking, although we've had babies in valet parking, but that's not what we want. You don't want 100 people surrounding you, catching your baby in the front seat of your car. So I talk to your providers, ask them, when should I go into the hospital? For some women, you don't need to labor. Maybe you're a repeat C-section. Maybe your baby's feet first. We don't want you laboring at home. For other women, it might be okay if you labor at home. Maybe it's your third baby and maybe your baby's head down and maybe you can labor an hour at home, or maybe it's your first baby and the baby's head down and you can labor a couple of hours at home. So for each woman, it's a little bit different situation. So talk to your provider, keep that open communication with your doctor. It's something very important to ask them about. We do not want you to be scared to go into the hospital. We do not want you to be in an unsafe situation because we want healthy mom, healthy baby. This is a stressful time in general for the entire country, and we want you to have a safe delivery. That's most important for this.
Great information. Childbirth Concierge commitment to the pandemic is we have been providing classes free of charge in both English and Spanish. And we're getting, as far as Puerto Rico, 8 or 9 different states right now. And one of the questions is, one of the things that we talk in generality of childbirth education is when do you go into the hospital? And the general rule is 5 minutes apart. Contractions are 5 minutes apart. They're lasting 1 minute long and consistently for 1 hour. And so we have some of those moms that want to deliver naturally and they want to wait a little bit longer. And really it is going to be important for them to talk with their care provider and find out what are the admitting guidelines, if you will, being that your water's not broken or you have a medical condition that it warrants out of the normal parameters of that. And so in teaching, I was teaching yesterday virtually, and one of the things is I told the moms, I said, I understand the concern and the fear and you want to hold off longer, but if you're trying to reduce, like you just mentioned, you don't want 100 people around. And if you wait too long and then we have an imminent delivery, now everybody's running very chaotic, trying to catch, and maybe they're not getting their face mask up fast enough because we have a baby going, and do we have sterile gloves, and what do we have? And so there is that fine line of not getting to the hospital so fast, or waiting too long, should I say, but trying to find that where you're in active labor, things are moving along, but you're not going to be, I know you probably could deliver a baby anywhere, but that's not the case. It's what is the exposure, what is going on.
Correct.
Really and truly, we want moms to feel comfortable, relaxed as best they can, whether they're planning on an epidural, whether they're not planning on epidural. And so, you know, really would hope that moms communicate. They're welcome to call us for support, virtual support. We'll do whatever we can.
Absolutely.
We understand it's a really stressful time for everybody involved. And, you know, I hear you saying, you know, Central Florida, we have, you know, hospitals are taking the precautions. What we don't know is somebody might be watching this YouTube and they're up in New York City, or they're in one of these really what we call the hot spots now. And, you know, what kind, hopefully hospitals across do, but I'm concerned as we go along in the weeks, what that's going to look like. And these truly
Right.
are valid concerns. So, you know, I really appreciate you taking the time to come on today. And we just want moms, our tagline is delivering their peace of mind. That's what we want. And I know that,
Absolutely.
I know you, that you feel strongly about that too with your patients. So we hope that you'll reach out to us if we can be of any service to you. And in the show notes, we'll show you how you can reach out to the website where Dr. Merritt is. And any last thoughts or anything that you want to leave us with?
Healthy mom, healthy baby. That's what we stress around here. That's what we want, is healthy mom, healthy baby.
All right. Well, I'm going to add sneeze in your elbow and wash your hands.
Yes,
All right.
ma'am. Yes,
Everybody.
ma'am.
Take care. Thanks for
All
joining.
right.
Bye-bye.